Hi, I'm Pam Cummings, and I'm the physical therapy consultant and the director of the I-Team Early Intervention Project. And I want to talk today about things to consider when choosing adapted equipment. When we consider choosing adapted equipment, it's important to think about three things: the child, the environment, and the task. We want to consider what the child needs for support, where they're going to use it, and the specific tasks we're going to ask them to do so that we know the just right amount of support to give them. When we think about the child, we want to understand what their strengths and motivations and interests are. We also want to have a full understanding of what their motor and sensory challenges are, as well as their preferences for positioning and sensory needs. This is often information that the team physical or occupational therapist gathers during their assessment. Next, we want to consider the environment. Where will the equipment be used? How much space is available in that area? And will the equipment need to be moved around within that room or between rooms in the house or the building? Also thinking about where the play and learning materials are located so that they can be accessed by the child. Last, we want to consider the task, thinking about the routines that we have the child do and what specific tasks within each routine we're going to ask of them. This will help us understand, again, the just right amount of support for the child. And thinking about those routines and tasks, what does full participation look like for most children? And that's what we're striving for our children. So again, when you're choosing adapted equipment, you want to think about the child, the environment, and the task. Here's an example of a child who's 2.5 who has cerebral palsy with a gross motor function classification level of 4. And this child especially loves to sit with her peers. The environment we're considering is an active childcare with toys located on low shelves. And this equipment will stay in the room, but move to different areas of the room. The task we're considering is the routine of circle time, and we want this child to be able to do greetings, which are very active, finger play with songs, and some choice making. Because we want this child to use her arms, we want to give her more support at her trunk and body so that her arms are freed up for use. In this situation, I might recommend something like a Firefly go-to seat to provide that support and allow it to be easily moved throughout the room. Another task the child would be asked to do is practicing her balance and sitting during some story time activities where she's listening, but also practicing her balance. Because of that, we want to provide a little less support, and something like the Lecky floor sitter or a back jack chair might work for that purpose. If you have questions about choosing adapted equipment, please find us on our website, go.uvm.edu/early intervention, and you'll find more mini trainings there. Thanks for joining me today.